Well, the biggest challenge is that there's no evidence right now no one has studied or effectively proven which social determinants are the most important to screen for which patients to affect which outcomes, right? We know that social determinants broadly affect health. Mostly it's driven by poverty. We can't necessarily intervene with poverty, so we try to intervene around housing, the way that the poverty manifests in more pragmatic ways, I guess, of how do we intervene with housing or food insecurity or transportation needs, childcare needs, those kind of factors. And, but figuring out, which patients need to be screened. I mean, in the community health center setting, when we screen patients for social determinants needs, they all tested positive. They all screened positive, right? It's 99% reported some kind of a social need. So that's important to understand. I think it's probably useful to screen most patients and establish whether there's to at least get some kind of a baseline and establish, but we really don't have very good evidence right now on, again, which patients need to be screened for which social determinant, and because we know that there's evidence that that'll lead to some kind of an improved outcome. So I think that's the biggest challenge right now is we're trying to figure out who to screen for what, and we don't have evidence to support that decision making. There's a lot of interest in looking at community level social determinants. How do those have effect on health? And that's, same idea. Could we use some information about a patient's community to identify which patients should have the screening for their personal needs or not? That might work. But again, there hasn't been enough patient-reported social needs documented in data sets that we can work with to do the analyses to figure out what's effective. So that's partly why my interest has been on, can we first figure out just how do we document this data? Let's just get this in, let's start collecting this data on patients. But what we're doing right now, because we're not sure, is it more effective to screen for housing or food or whatever for which patients, then there's, we're casting a broad net right now, but I'm really hoping we're going to be able to, as a scientific community and a public health community, narrow down onto like what are those factors that really are the most important, that again, and there's another part of this question too, which is what are you going to do with the data? What do you need it for? Is it that you want to make a referral to a community resource? Maybe. Is it that you want to just know what's going on so that your care plan can be changed? Maybe. Is it that you want to be collecting data for a policy reason so that you can say, if you're the medical director of a community clinic, you can then go to your legislators and say, hey, we have half our patients are coming in with food insecurity, but there aren't enough food resources in the community. I mean, depends what you want to use the data for. So there's tons of decisions that we need to make that we don't have evidence yet to base those decisions on, and that's, I think, the biggest challenge we're facing right now.